Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello again, and welcome everybody to another edition of A Snowball's Chance in Healthcare. My name is Josh Butler. I'm the host of this program, and I am the owner and co-founder of Butler Benefits and Consulting, located in Amarillo, Texas. We are a boutique healthcare consulting and brokerage firm, and each and every week on this program we're discussing and tackling a topic in healthcare. And you might be saying, well, healthcare is such a boring subject. Why do we got to talk about healthcare? And, I will admit that healthcare is not the sexiest of topics to talk about, but I'll tell you what people do care about. They do care about saving money in healthcare. They do care about, getting to improve their access to high-quality doctors without breaking the bank. And so each and every week we're discussing topics to give people hope in healthcare, to help them find high-quality healthcare in our community and communities across the country at a reduced price. And over the last couple of weeks, bear with me today, folks, I'm feeling a little bit under the weather. My kids have been sick this week, and they've had a little bit of bout of strep throat, and hopefully I don't have strep. I got tested this morning for that, but just feeling a little bit under the weather, so apologies if I don't sound as great as I usually do. Not that I sound great, but anyways, just feeling a little bit under the weather. But over the last few weeks, I've been getting a few emails and several calls where people have been requesting some more detailed information when it comes to a specific type of healthcare related service, and it's prescription drugs. Prescription drugs, when it comes to health insurance benefits, are always the most utilized benefits of any health plan. Lots of people take prescription medications, and so because we've gotten a pretty high volume of requests to talk more in detail and more specifically about ways to reduce prescription drug costs, that's what we're going to talk about today. So I want to get started like I do a lot of times and just remind some people of some statistics. Over 131 million Americans today take at least one prescription drug. I'm among those. I take a blood pressure medication. I've got a pretty stressful profession, and high blood pressure runs in my family. I take a prescription for that. And the average American, believe it or not, how many prescriptions do you think an American takes, the average American? It's four prescription medications every single day the average American takes, and 131 million Americans take at least one prescription drug. That amounts to over 4 billion, with a B, 4 billion prescriptions are dispensed in this country every single year, right? And it's a staggering number. We're a highly medicated society. Lots of people take prescription medications. But I will tell you, and I'll remind you of this statistic, over 1/3, 35% of all people that are prescribed a medication in the United States, they either skip their initial fill or they skip their refill because their prescription drug is too expensive, right? That's a big problem. And when you take 35% of 132 million Americans, guys, we're talking about 43 million people in this country are unable to fill their prescription medications because they're too expensive. And that leads to all kinds of problems. It leads to higher A1C numbers, out of control blood pressure, out of control blood sugar, out of control cholesterol. And, those are the leading causes of death in this country. And how much, money, not just money could we save, but how much could we improve people's lives if we were able to just impact the affordability of some of the most basic medications in the country? And today, That's what we're going to talk about. I'm going to get down and dirty. I'm going to get into some details, ladies and gentlemen. I'm not just going to give you high-level strategies. I'm going to talk about some specific tools and resources that we use to help people save on prescription medications. And maybe some of the tools that we're going to talk about today you've already heard of. If you haven't, well, I don't know what rock you've been living under. But we're going to talk about several specific resources and tools that we use at Butler Benefits. And number one, I'll go ahead and get started. And I'm going to start out with probably the most common resource that everybody's heard about, and it's GoodRx. Okay, GoodRx. If you haven't heard of GoodRx by now, well, I don't know what your planet you're living on, but GoodRx has been around for quite some time. It's a free mobile app. You can download it on your phone. And it's a shopping tool. You're able to download this free application either on your phone or you can use it on a computer. And it allows you to put in your zip code, and it's geo-specific. And then you can start to type in your medication, right? And I've used a lot of examples on the show in the past. I do it a lot in open enrollment meetings where you plug in like losartan. I'm going to use the medication. I don't care. I'll tell the whole world what medication I take for my blood pressure. It's losartan. So when I'm prescribed losartan, you can type losartan into GoodRx, and it will show you the cash price. Now, not the insurance price. It'll show you the cash price. So, number one, the prices you see on GoodRx, ladies and gentlemen, those are cash prices. Those are not discounted prices with insurance. That's if you opt out of using your insurance and you use the coupons and the rebates that are available through GoodRx. Those are cash pay rates, cash prices you're going to pay at the pharmacy. But one example that I like to use in a lot of meetings that I go to, I take losartan. And here in Amarillo, I fill my prescriptions at Market Street Pharmacy over on Georgia. It's pretty close to my office. And through GoodRx, I looked it up even before this show today. If I fill my losartan through GoodRx at United Market Street, the cash price is $17. $17. And for those of you that are familiar with Amarillo and how Amarillo is laid out, you know that catty corner from Market Street United there on Georgia is a Walgreens. And I'm not trying to out Walgreens. I'm just saying, I mean, this is public information. Anybody has access to this information. My exact same prescription, same dosage, same frequency at a different pharmacy right across the street, ladies and gentlemen, is $48. $48. So the price variance from one pharmacy to another, it can be dramatic. And so lots and lots of people, millions of people all across the United States are already using GoodRx, okay? I want to let you know a couple of the statistics about GoodRx. Currently, right now, through GoodRx, there are more than 1,000 prescription drugs that you can get through GoodRx that are less than $10 cash. 1,000 medications that are under $10. Now, they're mostly generics, and that's fine because that's mostly what a lot of people take is just generic. Like losartan, my blood pressure medicine, is a generic medication. It's not name brand, and it's certainly not specialty. Okay, so I want to pause for a second. I want to talk to you people out there that have traditional copay insurance. Okay, it's not infrequent that I come across an organization that has a health insurance plan and they have copays, okay, for their prescription drugs. Typically, it's a 4 to 6 tier copay structure. Tier 1 is going to be what you're going to pay in a copay for generics. Tier 2 is for preferred brand. Tier 3 is for non-preferred brand. And like Tier 4 may be for specialty, right? But I want to tell you guys something. Take a look at your generic copays, right? Is that I have seen plans that are currently, these aren't grandfathered plans. These are newly available plans through companies like Blue Cross Blue Shield and United Healthcare that have like a $15 and in some instances a $20 generic drug copay. Okay, so listen guys. If GoodRx has 1,000 generic medications for under $10, why on earth would you ever pay a $20 copay through your insurance to purchase a $3 medication or a $4 medication or a $7 medication? So it's because we're conditioned that, I pay so much for this health insurance and I'm going to use it. Well, guys, this doesn't always make sense. And this is why these tools exist and why you should be using them. Now, Walmart is another perfect example. They have a list of hundreds of medications that we call that are in the $4 club. Okay, why pay a $20 copay for a prescription for a drug that costs $4 cash or $3 cash or $2 cash. It's always prudent to use tools and resources like GoodRx, okay? Check your benefits, know your copays, ladies and gentlemen, and which tiers your drugs fall into so that you know if you're saving by using GoodRx, okay? GoodRx, that's one. Second resource that we tell people and individuals and even companies to use is an organization called Cost Plus Drug Company. Now, not very many people are familiar with Cost Plus Drug Company, but lots of folks are familiar with a man named Mark Cuban. If you don't know who Mark Cuban is, again, I don't know what planet you're living on, but Mark Cuban is the owner of the Dallas Mavericks, and he lives in the Dallas-Fort Worth Metroplex. He owns the Dallas Mavericks, and he's also on Shark Tank. Many of you have probably watched Shark Tank, and you see him, and he makes investor deals through that organization. But he also started a prescription drug company called Cost Plus Drug Company. And the name is self-explanatory. What they do is they purchase drugs, predominantly generic medications, directly from manufacturers at the manufacturer's wholesale price. And then what they do, folks, is they mark that drug up 15%. And they're very transparent about it. If you go to their website, costplusdrugs.com is their website. They have all of their medications that they can source directly from manufacturers. They've got it published on their website. And so there's been a lot of, discussion. It's gotten a lot of attention in the media over the last, probably 6 to 8 months. But we use this site. And I can tell you their pricing is extremely competitive for a lot of drugs. And so if you're in the market, if you're in a high deductible health plan, or maybe you're uninsured and you don't have prescription coverage through your benefits, GoodRx and Cost Plus Drug Company. These are two different websites and two different companies that you can go to buy drugs with cash. Okay, you don't need health insurance to buy a $3 medication. I'm sorry to break it to everybody. Okay, let's get that out there. You do not need health insurance to pay for $3 medications. You don't need health insurance for amoxicillin or penicillin. Now we're having a problem getting amoxicillin right now because of the flu and everything, and because of, it's the fall season and the flu season. There's a shortage of it right now. But guys, it's not expensive. We have to get out of this mindset of, well, I've got a prescription. Here's my insurance card. Let me file a claim on my insurance. I said this to an organization earlier today, is how expensive would our car insurance be if every time we needed an oil change or, to change windshield wiper blades that we whipped out our Geico card and we filed a claim. When we use car insurance to cover big losses, like big major accidents that total the vehicle. That's what insurance is for. All this maintenance stuff, we are so used to paying cash. And that's really the way we need to be treating our health insurance and our health care in this country, is that you don't need health insurance for a $2 medication. I'm sorry, you just don't. And so if you need a generic medication and you don't have health insurance, there's tools and resources out there like GoodRx and Cost Plus Drug Company, okay? So that's two. Anybody can use these resources. These are free to people. You can go to Mark Cuban's website, costplusdrugs.com. You can see all the prescriptions that they can fill there, and they mark it up 15%, and that's how they make their money. All right, strategy number 3. One that is, I wouldn't call it controversial, because in July of 2020, the Trump administration directed the HHS secretary, who at that time I believe was Seema Verma. She was the head of the Health and Human Services Department in Washington. And the Trump administration directed the HHS to publish and finalize their rules regarding the importation, okay, listen up, the importation of prescription drugs from Canada and other foreign countries that have an equivalent to our FDA, our Food and Drug Administration. And so they did that back in July of 2020. So now individual importation of prescription drugs is allowed, okay? So it's just allowed. Now, listen closely. If you're an employer out there, you can't go to all your employees and start taking orders. Well, what do you take? And what do you take? And what do you take? And order all this stuff from Canada and bulk ship in drugs from Canada. You can't do that, okay? We're talking about the individual importation of prescription medications. It's allowed. The savings potential, everybody, if you pay any attention whatsoever to politics or to pop culture or to anything like that, prescription drug costs have been a huge issue, right? They've been a huge subject and a huge topic of conversation on the political scene, and they're always an issue with voters and families because, like I said, 131 million people in this country are taking at least one prescription drug. Well, people, you'll be shocked at how much less the exact same prescription medications are in other countries compared to what they are in the United States, okay? And so the savings potential is massive, and I'm going to give you a couple of examples. I'm going to start with a very popular medication, even though it's got a generic equivalent now, but back in the day, a lot of people in this country, they still take brand name Novolog. Novolog is an insulin, so a lot of diabetics are on Novolog. I can tell you, ladies and gentlemen, that a 30-day supply of brand name Novolog, this is not generic, this is brand name, in the U.S. is $298 for a 30-day supply. Just basically $300 a month, okay? In Canada, I can get the exact same product, Novolog, brand name, 30-day supply, same manufacturer, same dosage, for $89. $89. Now, if you're on a high deductible health plan, or if you're self-pay, or even if you're uninsured, think about the difference. If something costs $300 a month versus $89 a month, that, to a lot of folks, listen, I mean, that is the difference between treating diabetes and not treating diabetes for how many people out there. $300 a month versus $89 a month is a big difference to a lot of people out there, guys. Makes a big difference. Let's stay on diabetics right quick, okay? Jardiance is another very popular medication that's on the market. Millions of people are on Jardiance in the United States. 30-day supply of Jardiance in the United States, $558 per month for a 30-day supply. In Canada, same 30-day supply, same drug, same manufacturer, Jardiance, $129. Again, $558 versus $129. The difference, a border. Okay, that's all that's differentiating between, the price in Canada versus the price in the United States. Now, in my career, I've helped, probably hundreds of people procure medications for much, much less. We've got testimonials on our website. We have friends that have written, testimonials. We've published them in blogs, and we help people with these types of strategies for the personal importation of drugs from Tier 1 countries. Countries like Canada, Australia is another, New Zealand is another. Believe it or not, Pakistan is one, and India is another Tier 1 country for pharmaceuticals. I'm going to use one more example before we move on to our next strategy. Humira. Humira is a drug that is manufactured by a company called AbbVie, AbbVie. And a biosimilar is set to hit the market in 2023 for Humira. But for at least a decade, Humira has been the number one grossing prescription drug in America. It is a drug that's used for ulcerative colitis, for rheumatoid arthritis, and for Crohn's disease. And ladies and gentlemen, it carries a monthly price tag. It is a monthly treatment for people primarily with rheumatoid arthritis. But the per month price tag, $6,628 for one dose for a 30-day supply of Humira. Okay? Now we're going to come back. We're going to talk a little bit more about Humira and about AbbVie here in a second when we talk about our some of our next solutions and strategies. But we're talking about international sourcing right now. AbbVie sells Humira all over the world. Okay? $6,628 for a 30-day supply in the United States. In Canada, $2,199. Excuse me. It's a third of the price. It's less than a third of the price than it is here in the United States. There is no generic to Humira, ladies and gentlemen. It is it's made by this manufacturer, and this is what it sells for in the United States, and $2,199, basically $2,200 is what we can source Humira for out of Canada. Now I want to put something into perspective for you guys. That's a big savings. That is like $4,500 a month, $4,400 a month that a person could save, or an organization could save, or perhaps a company could save if you just sourced it from another place, right? To put that in perspective, right before I started this show today, I got on the internet and I Googled what it would cost to fly from DFW Airport to Toronto. So even if you sent an employee, if you went yourself from Dallas-Fort Worth in an airplane, flew into Toronto, had a prescription, went to a pharmacy, filled your Humira, it would cost $2,199, okay? A round-trip ticket from DFW to Toronto and back is $498. You could spend $500, fly to Canada, and you would still be netting $3,900, $4,000 per month. And guys, this is called medical tourism, and don't laugh at this strategy, because not just for drugs, but for expensive surgical procedures, expensive diagnostic procedures, employers are sending people. They are putting people on airplanes and sending them to other countries around the world to buy drugs, to get surgeries, to get diagnostic tests done. And we're talking about, there's no difference. It's Humira. It's the same drug you can get at Market Street United or Walgreens right here on Georgia Street. Okay, but think about that. This is what employers are, doing as far as like creating innovative solutions to get their people affordable medications, affordable care. Okay, international sourcing. Don't forget about that. If you want more information on ways you can source your drugs from Tier 1 countries, feel free to call me. 806-350-3158, or get on my website or connect with me on LinkedIn. We share these strategies all the time. The next one, okay, is patient assistance and manufacturer's assistance programs. I'm going to use Humira, and I'm going to wrap up here pretty quickly on this. The manufacturer of Humira, as I mentioned, is a company called AbbVie. AbbVie, for people that do not have health insurance or people that are underinsured, AbbVie will give Humira to people at $0 for free if you make under 600% of the federal poverty level. You have to apply through a patient's assistance program, and for those people that qualify, that's people that make under 600% of FPL, you get the drug for free. Okay? So how much is 600% of FPL? For an individual person, if you're a single household and you're not married and you don't have tax dependents, that's $82,000 a year. You can make up to $82,000 a year and qualify to get Humira for free. For a family of 4, guys, $167,000 a year. Families with a couple of kids, you can still earn up to $167,000, and you're financially qualified to receive Humira for free. Now I want you guys to think about that for a second. That's a lot of money. Family of 4, $167,000. If you make anything under that, you can source a lot of these drugs for free. There's 4,900 specialty drugs in the United States, and there are 40,000, count them, 40,000 patient assistance programs available to people out there. So those are 3 resources that I've given you specifically: GoodRx, Mark Cuban's website, and needymeds.org. That is the manufacturers where you can go and get information on all kinds of manufacturer assistance programs for specialty drugs and costly name brand drugs. And we are incorporating these types of resources into self-funded strategies that dramatically reduce employers' cost when it comes to prescription drugs. Since we've been getting a whole lot more, requests to talk about prescriptions, guys, to me, it's the lowest hanging fruit in healthcare. We can help organizations and we can help people reduce their healthcare costs in so many ways, but this, with prescription drugs, is the easiest. It's the least disruptive. The last tip I'm going to give you employers out there is this is a massive opportunity for your companies. If you transition to a self-funded health plan, like our High Plains Health Plan, and you use independent PBMs, that's independent pharmacy benefit managers. These independent PBMs that we work with through my organization, they allow you as employers to pursue strategies like international sourcing, are manufacturer assistance programs or patient assistance programs like we just discussed. The big box PBMs that are bundled up with your fully insured health plans, they won't allow you to pursue these types of prescription drug solutions and strategies. So remember, it's in the plan design, it's in the type of proactive way that you offer benefits to your employees that we can leverage these types of strategies and many others to reduce your pharmacy costs, and we can show you how. Thank you so much for tuning in to this week. As always, we're here to talk about things like high-cost prescription drugs, high-cost surgeries, to give you and your employees a snowball's chance in healthcare. We'll see you next week. Thanks for listening.